What is the R.I.C.E method?
R.I.C.E stands for rest, ice, compression, and elevation. It's a commonly recommended protocol for managing minor injuries such as sprains, strains, and bruises. The method is designed to reduce pain, swelling, and promote early healing after an acute injury. Knowing when and how to apply R.I.C.E can help prevent further damage and speed up recovery.
When should you use the R.I.C.E method?
The R.I.C.E method is best applied immediately after minor injuries, such as twisted ankles, mild muscle strains, or bumps and bruises. It is not intended for serious injuries like broken bones or major wounds, which require professional medical attention. If the injury is accompanied by severe pain, visible deformity, or significant bleeding, seek medical help right away.
How do you perform the R.I.C.E steps?
First, rest the injured area to prevent further harm. Next, apply ice for 15 to 20 minutes every hour to reduce swelling and pain. Use compression, like an elastic bandage, to help control swelling, making sure it's not too tight. Finally, elevate the injury above heart level whenever possible. This helps limit swelling and discomfort.
How long should you use R.I.C.E?
The R.I.C.E is typically recommended for the first 24 to 48 hours after an injury. If swelling and pain lessen, you can begin gentle movement as tolerated. However, persistent or worsening symptoms or signs like numbness and severe bruising indicate that you should consult a healthcare professional.
Are there any limitations to R.I.C.E?
While R.I.C.E is effective for many minor injuries, it is not a substitute for professional care in more serious cases. Remember not to apply ice directly to the skin and avoid over-tightening compression wraps. Always monitor for unusual pain or worsening symptoms. For older adults or those with circulation issues, seek medical advice before using this method.